evening again. Clare McCarthy, producer and host of Transcat the podcast, now in its 4th season. And I am going to call an audible off the bat. Bree was kind enough to give me some introductions for each of you, but that seemed like a lot of work. So, Representative Gilchrest, if we could start with you.
Great, yes. Good evening, everyone. I'm Jillian Gilchrest. I represent the 18th District in West Hartford. This is my 4th term, which means I'm in my 7th year. Before becoming a state rep, I was an advocate. So I worked for different nonprofits in the state, and I would lobby the legislature on social justice issues. So primarily women's reproductive health. Then I went on to do economic security, and then not gender affirming care, but now it becomes order, preventing gender-based violence. So those were my big issue areas. And when it comes to the LGBTQ community, I've always just been an ally. To me, it is a social justice issue. It's just everybody's right. There is also a direct link to the work I've done in reproductive health care. And so there's oftentimes a crossover, but really just see this as a human rights issue. And I don't think people should be involved in making decisions about people's lives for them. Thank you.
My turn. Hey, I'm Representative MJ Shannon. I represent the 117th District, so that's down on the beautiful coastline of Milford, West Haven, and Orange. And I am one of our 5 small but mighty LGBTQ plus caucus members in the legislature. And I just went through my first session, kind of wild, but learned a lot and got some good stuff done, especially for our elder LGBTQ plus folks. So that was really cool.
And hello, everybody. Last but not least, I'm State Representative Sarah Keitt. I represent the 134th District, which is Fairfield and Trumbull, and my pronouns are she, her, and mom. I first want to apologize if I'm speaking too softly or I'm a little hoarse. I had some neck surgery earlier this week, but it was so important for me to be here. I am in my 2nd term, my 3rd year, and before coming to the legislature, I worked in public health as a health advocate for medical research on women's health issues, and also with the disabilities community, mostly as an advocate with the National MS Society. I came to this issue around LGBTQIA and especially gender affirming care. Not only, I know I was your typical progressive Democrat, yeah, I'm an ally, but I'm also the incredibly proud mother to Theo, who at 15 came out as non-binary, and they are now 19, living their best, most authentic life, and just coming to these issues, seeing the world through their eyes, and how incredibly amazing gender affirming care can be for people, for young people especially. So, it falls right in with everything else that I advocate for as far as human rights, medical rights, but it's also very personal to me as well.
Thank you all. On my show, and as I look around the room, there are a number of people here who have been on the show. I work really hard to make sure that my guests feel safe. That's important to me. And so before I get to the stack of questions I was given, I wanted to make sure everybody understands that this tonight is a safe space for them, a safe space for you. To that end, what situations might keep you from being as fully transparent with your answers tonight as some of the folks in the audience might like? What do they and I not know that you would want to be cautious about?
I think I am going to anticipate a certain level of disappointment, that we don't have more concrete details to share with you. And some of that is because we don't want to jeopardize the process. And tip hands of people who are working on different issues. And also in some cases, we're just not there yet. That's the only thing that's going to hold me back as far as my own personal safety. I'm not worried about it. That's, part of what I signed up for. So.
I have a very similar answer. My personal safety is, I don't know if we'll be pushing those bounds tonight, but I think there's going to be some questions and our answers won't get to that end that we're looking for right now, but always know that we are pushing. So thank you.
And in complete transparency, I think I still always have, I fear that I'm going to say the wrong thing. And so if I do, I am very open to listening and learning. So thank you.
Thank you all. I thought I would lead with the most important question. What is being done to protect youth and adults in Connecticut, but especially youth, who are receiving gender-affirming care?
I wish I could say we have an answer for you right now. We don't. In all transparency, we don't. We're working with folks across the spectrum in the state level, with nonprofits, with medical providers, to find a solution and to convince our governor, honestly. We have to convince him to form some sort of state option that is out from under Medicaid. The issue with the gender affirming care and the youth clinics here in the state, it's because the White House has threatened Medicaid credentialing for the hospitals and all the providers in any place that provides gender affirming care for youth, which means that Yale Hospital could not receive any Medicaid dollars at all for any healthcare that they provide. And that's tens of billions of dollars, money that there's no way the state could make up, money that there's no way private insurers could make up, which would mean that Yale Hospital would fold. It would mean that all the Yale clinics would fold across the state. So we need to find a solution that is free from Medicaid. And that's a big lift. And we are actively in discussions with different groups and working on it. I don't know if my colleagues here would have anything to add.
Yeah, I would just, I think the goal, so yes, we've been having meetings with a variety of partners, including also the Attorney General's office, just many conversations to understand kind of all aspects. And so my role also is chair of the Human Services Committee, where we oversee the Medicaid program. And for many of these providers, CCMC, Yale, Medicaid is almost the largest payer to their system. So if they were to lose that they'd be done. And they do provide a whole host of other important healthcare. I think the goal for many of us is, can we support kind of like an independent type clinic? And so figuring out what that looks like, because a second piece that I don't think has hit yet, but could potentially hit, would also be, because they're being so cruel, the White House, is in addition to this threat about the provider itself not being able to engage in, so the entity itself not being able to provide Medicaid services, should they continue to do gender affirming care. The other piece is then, if you yourself are a provider who wants to do this in off hours, you can't then work at the place that provides the Medicaid. So not only do we need to support kind of this entity, we'd also need to support those providers. And there's many of us on board to do that. And so we are having those conversations about what that would cost, what that would take, and how we can get there.
Yeah, and while we're looking at the solutions for providers and looking for Medicare for all that, we are also working with these partners to do kind of what we're doing right now. We need to get into our communities and get our community together and make sure that we have that communication between each other, and we know that, so that you know and the public knows that we are working on those solutions and we are working on them collaboratively. We're not trying to keep anyone away or out, like not at the table. But that's, I think, a really big thing that we are doing in the state, is that I do it all the time when I'm trying to host events in Milford with our Milford Pride, is just making sure we're visible in the community and we are strong and people can see us.
As you're doing all of this, as you're Robert Frost-like looking down different paths forward, do any of those involve interstate collaboration? I mean, I realize you're state representatives, so you have your own jurisdictions, but you mentioned the AG, and I know he's involved with multi-state efforts. Is that a possibility going forward?
That gets to the bigger issue of what's going on with our healthcare system right now. With the clawback of the subsidies for our health exchange, healthcare costs for people who buy their health insurance through the exchange are going to skyrocket this next enrollment session. We have people who will be losing Medicaid coverage because we now have these draconian enrollment rules, and people are going to re-enroll so often that it just becomes too burdensome. There are going to be more work requirements. So there's a lot of talk out there about forming sort of a New England co-op. Again, I don't know if either of you have been privy. A lot of those discussions go a little bit above our pay grade, but you know, California is talking about doing the same sort of thing on the West Coast, but sort of leveraging the buying power of several states, increasing the risk pool, which is what insurance companies use to, you know, you need a lot of people to make sure that you cover the healthy people, or you know, subsidizing the people who have more health issues. You know, it might, what the Republican Party in the White House is doing is could backlash, and they could find us maybe having, you know, single payer health care eventually, which would be wonderful, I think, for a lot of people. But again, those are all, a lot of this is happening quickly, and we still don't have all the details coming about what happened in HR 1. I refuse to call it the big beautiful bill. It's HR 1 or the big bad bill. But HR 1 is what we're talking about that's going to be affecting our healthcare. And so whether we might have a similar model for gender affirming care, we don't know yet.
Yeah, I think for me, it's like, I don't know how we're not already at the tipping point. I'll put that out there. That said, when do we get to that tipping point? And when it comes to healthcare, I just had the good fortune of being at a conference learning, I mean, maybe this is good fortune or it was very negative, of the impacts, the potential impacts to Medicaid in particular of HR 1. Like how long are states going to take the federal government using money to push an ideology on us that we don't believe in? And they're doing that through Medicaid, obviously. And so to me, it's kind of like, you know, folks who are concerned about gender affirming care, they're also doing it in terms of undocumented immigrants, also other types of immigrants, quite frankly, and also in terms of reproductive health care. So, you know, how can we kind of take all these issues that are impacting people, and maybe that would help elevate the voice to push us in a direction of partnering with some of the blue states who feel the same way we do right in this area.
Yeah, along that same line, it's really to like convincing our colleagues and our leaders that we need to be making these pushes. And we have some people that are still trying to tiptoe and dip their feet in the water and feel around. But I believe as well, we're at that tipping point at this time where that's not how it should be anymore. And we should be looking to collaborate multi-state.
And I will say this, I've changed the way I talk about some of these issues I mean, I'm just going to get this out here. I'm a lefty progressive, you know, you name it. But I'm starting to look at things with a different lens on the economic viability of things that we are doing and the economic consequences. And these Republican edicts that are coming down from the White House are bad for us as a state from an economic standpoint. By throwing so many people off of Medicaid, by denying them access to health insurance through our exchange, we're going to wind up with an enormous amount of uncompensated care in the emergency rooms, which drives up healthcare costs for everybody. The only people who are going to keep their, who will end up keeping their insurance are going to be people who need it, which is the people who are very sick or have very high healthcare costs. People like me, if I freely admit, I live with multiple sclerosis and Crohn's disease. I can't live without health insurance. So I would, spend every penny in my bank account to make sure that I had access to healthcare. For the healthy people, they'll just say, no, I can't afford that extra $4,000 or $5,000 a month. I just can't. And so you're going to be left with a sicker patient pool, which drives up healthcare costs for everybody, which hurts our economy. So while yes, it is absolutely human right to have universal health care, we need a solution that's going to support our economy. And that is going to hopefully be something like a regional health system, short of a national health system. So if you hear me talking about these issues in economic terms, it's only because it's another way to help get people from the other side of the aisle, and even some people who are in our party, like our governor, to really look at these issues, not so much as a left and right, but economic viability.
We're talking here both macro and micro, and most of the conversation so far has been macro, and that's your responsibility. You're dealing with state government, you're dealing with the institutions like Yale and Connecticut Children's and so on and so forth, and insurance companies, but there are kids in the conversation here. So to this next question that somebody put in, what stopgap measures and supports are being considered or are currently available for trans minors who are freaked out by all this?
I think right now it's such we're in such a difficult place that these institutions are basically bowing down and saying they have to shut this down right now when we have such a large population of minors and youth that need these services, and they are life-saving services. So I have been working, and I know there's a number of our colleagues that have been working to really find those people in our constituencies and continue to reach out to them and point them to, at least we still have a couple providers available, but of course there are waits and we don't know how much longer things like that are lasting right now. But I think it's keeping your folks tight and keeping that communication open. I mentioned it earlier. I think that's a big thing that is what's going on right now too.
And I don't want to give medical advice because I am not a doctor. I can share with you what, my child's provider shared with them. Instead of they were, prescribed vials of testosterone, they would only use a little bit each time and they'd discard the vial. They were told to keep using the vials, to stretch it out, sort of stockpiling it. If you have the ability to stockpile. There are some out-of-state pharmacies where if you can get a prescription, you can get it filled. Talk to, if you've got a pediatrician who is willing to prescribe, if they're not affiliated with the Gender Affirming Care Clinic. I mean, you can get your medical records and have that sent over to your pediatrician. Hopefully they can prescribe. I already told my husband if they start going after gender affirming care, he's going to suddenly come down with a case of low testosterone. And again, I sort of say that jokingly, but again, I'm not a doctor. I am not giving out medical advice. I'm saying talk to your own providers. Find a solution that works for you and your family. And it might not be through a gender affirming care clinic, but if your pediatrician isn't supportive of your journey, find another pediatrician because there are plenty of them out there who are supportive and will be supportive.
And I would let people know, especially since this is being filmed, like, that's our role as a state representative or a state senator, is you can call and ask questions. Now, I get in this context that might not feel safe with certain representation. And so folks could reach out to members of the LGBTQ caucus. And then if they get too much, they know they have allies that they can connect with and we can help support. But that is an important role of ours, to connect folks to the resources that are available. And so I would encourage folks to do that, again, with legislators you know are a safe person.
My last name is McCarthy, so I am contractually obligated to say this. I want you to name names. I have two. So it's a decades-old tradition. I have two questions here from folks. What Connecticut-based organizations are advocating against gender-affirming care? And what Connecticut elected officials are advocating against gender-affirming care? Now, I realize that puts you on the spot to some extent, but I'd like to know.
Well,
Literally
Oops.
going back and watching debate on the floor for the bill that I had to take under. So she got
Yeah.
some of them. We had, Fishbein, of course. I don't even like he's like Voldemort to me. I like don't even want him to come. Like,
But these are people, these are members who stand by this. It's not like we're outing them. They stand by
Exactly,
this,
yes.
absolutely, and
And I don't know if they have a website, but they are the Freedom Caucus. Is that correct? Is that their
I think that's
grouping?
one.
So
there's also the Let Kids Be Kids caucus.
okay.
That was from
nice.
last session.
Yeah.
Yeah.
And
As
then
long as you're not a trans
and
kid.
I'll go there immediately. The organization is the Family Institute of Connecticut, and they have no qualms coming after me, so I will definitely put them on blast.
Oh, the Yankee Institute?
Yeah.
Yeah, but the Family Institute of Connecticut, you know, says that they're, again, their name, but they are anti-humanity, quite frankly, and come for everybody. So they say horrendous things that are.
Dubitsky, that's one.
Oh.
Yeah.
Thank you.
There are young people here, so I'll not repeat what he said on the House floor. But you can watch any of any of his conversations on gender affirming care.
Yeah, and I think too, though, there are these are specific people and specific organizations, but we are seeing it literally from the top down. They have all kind of fallen in line, and they say they might be supportive of this person. I have a gay cousin, I have this, but we know. It's like,
Yeah, because then the question is, will you stand when the time comes? Or is that just lip service to some gay cousin you might or might not actually have? Will you stand? This question has a bit of nuance to it that I want to just add, and that is that one of the divisions within the trans community is over the issue of passing privilege. I'll speak for myself. I don't have it. Anybody who looks at me knows who and what I am, and there's no way around that. So for me, that cancels out some options. But a lot of people, particularly young people, have the option of living stealth. And in this climate, that's life-saving if you have the ability to do that. And so this question, it seems to me, needed that little bit of preface, because the question is, what protections are being put in place for patients as far as personal and medical information being shared without permission/consent by the patient? And what assurances is the state of Connecticut putting in place to protect this private information?
Deep sigh, because I hate to go there, but the data, any data that was in Medicaid already got sent. And so it got taken back, but it got sent, which means the federal government has it. Going forward, we can do things, but I just learned that recently, that they got access. So I don't know who has it or where it is, but it would be disingenuous to say that it didn't already go with the addresses and everything. So, yeah.
We do have an amazing Attorney General who is here to fight the fight for any Connecticut resident who feels they are being harmed by this administration. We have very strong shield laws for our providers and privacy laws. But again, once the federal government did their thing, they did their thing. I will say to you now, if they start coming after trans kids in any, well, I mean, they already are, but I mean, I will stand in front of that tank, that ICE vehicle, whatever they're going to do. We will not see what happened in 1930s Germany happen here without a fight. I mean, this is my kid. You know, I'm in this with you guys. So any fear that you're feeling, any anxiety you're feeling for your own safety, your children's safety, I'm feeling it too. So I'm right there with you. I wish I had better answers, but I do know we have an amazing advocate in our Attorney General.
And then I'd also say, again, having just gotten to go to this conference and really been in the weeds on Medicaid, at the conference kicked off with two Trump administration officials. I was not prepared for that. And they actually talked about Dr. Oz like he's a real person. So that was very overwhelming, but okay. They are big on technology and pushing states towards using certain vendors. And so luckily a whole team from Connecticut was there, and we're all looking at each other and I'm like, nope. So I think it's going to be important because they're also going to be offering a 90-10 match, which means they'd pay for 90% of it and we'd only have to pay for 10. That sounds awesome. But if they're going to have access to all this data and we're using a system of theirs, I am not comfortable with that in any way. So I think it's going to be very important as this starts to roll out, like, what are we talking about here? And that's where, again, I think kind of like a regional consortium could be good, because then we could all pool our resources and have our own technology separate from whatever they're doing.
Yeah. And as my colleagues have said, like we have the shield laws that we need to keep strengthening, and unfortunately that data is out there, but going forward, we do need to be making sure personally we are keeping ourselves safe online and not sharing. If you're not comfortable and you don't want that information being out there, you really do have to be careful of what names and birth dates and all that stuff you're putting in to social media profiles, or buying things online and things like that, because you never know now who's going to sell your information and who's getting that information. So we really do just need to be protected and personally be safe and just know how to use things properly.
And we also have been trying to strengthen our hate speech laws here in the state. I passed legislation a couple of years ago to look at hate speech in schools. We have another hate speech bill that we passed. And we need to really start, I mean, yeah, we can all say, yes, we support the First Amendment, but hate speech is a whole different thing. And even as we saw yesterday, I would happen to, Charlie Kirk, I'll say it, the elephant in the room. I do not think he was a good man. I think he did real damage to a lot of kids and a lot of people. He didn't deserve to die for his words. Nobody deserves to die for what they say. But we can hold people accountable. So that's what we need to do with our hate speech laws. And we need to, and you want to protect yourself. And as you saying, not having the privilege of passing, I do have to say, you remind me an awful lot like my 4th grade teacher, Ms. Mount. So.
I love that.
Thank you. I'm going to be getting angry emails from what's her name?
Ms. Mount? Oh,
Ms.
no,
Mount,
she was my favorite teacher. She was my favorite. I had her for both 1st and 4th grade, and she was my very favorite teacher. So.
If only I had the patience and the skill set to be a fourth grade teacher. One other aspect of gender affirming care that we don't often think about, because we've got the institutions that kind of overshadow everything, and you've got the consumers, you've got the kids and their families, but it sounds like hyperbole, but I'm not sure I would be alive if not for my care provider over at Middlesex. I regularly attribute part of that to her. So what are we doing to protect the care providers, both the folks at Yale and Children's and at the ones who haven't, forgive me, caved yet?
Again, we have the shield laws to protect them. But I also think we need to make sure that we are providing the resources to, it's part of the gender affirming care is not only the medical treatment, but the social emotional support that these providers can give students or children. And that's not saying transgender kids are mentally ill. I am saying the stress and the stigma and the societal pressures to live your life as somebody else can have negative effects on your mental health. So we need to make sure that those resources are there, that physicians are actually getting reimbursed for it, that they are allowed to give that care, which Yale says they are still continuing that, the social emotional support that goes into that. But I don't know if they're actually doing that.
Well, actually, the episode of the show that's coming out this Friday, so that would be tomorrow, right, is with Dr. Nicholas Mead from Yale. And we had recorded it last year sometime, but I reached out and we did a little add-on at the end about what's happened at Yale since. And yeah, he says he is still providing therapeutic care, whatever the correct term for that is.
I'd say there's lessons learned, again, from the reproductive rights movement, unfortunate lessons, but lessons in terms of violence perpetrated against abortion providers. And so I think it's important for those of us to go out and listen to the providers to hear what they need to keep them safe, physically, mentally, and then those of us in the legislature push to pass those things. And it won't be easy because of, the pushback that even that would receive, but we need to hear them and go in that direction.
I support any plan that starts with ask them what they need. That's just basic good practices. This one is not my question, but it's entirely selfish, so I'm asking it. What do we do to resist when they come after me? When they're done beating the hell out of trans kids and they come for the adults, what are we prepared to do?
Yeah, this is why we've been really trying to collaborate with our providers. We collaborate with different organizations and our other colleagues, because we are going to need to have people stand up, writing letters, using their voice, and being extremely visible and being in other people's faces, like, quite frankly, and being like, this is life or death for us. It really is. And why are you not seeing that? And I think that's kind of what it might have to come to. And we are going to proudly be there. And we have so many supporters to be there, but using that voice and using the power we have in numbers to show our strength in these difficult times.
We kicked off the Reproductive Rights Caucus last year. I co-chair that, if you haven't caught on. I talk about it so much. We kicked off our meetings last session, and the first one was we did a language training on talking about trans and LGBTQ, because my take was that there are colleagues who just felt uncomfortable and didn't know how to respond to some of the attacks and felt like they were going to get it wrong. And so we got into a safe space And we had someone who could do the training, not us, came in and talked to us so people could feel more comfortable because we knew it was coming. We knew, because they really, in the legislature in Connecticut, have shifted from a tax on abortion, and it's all trans. And so how could we be the best allies we could be to get more comfortable? And that's what I just feel like, if I can be someone who's comfortable having conversations, not being on the defensive, just speaking very direct to why trans folks deserve to have the healthcare they need and saying it in a calm way, I feel like that's what kind of can help change things.
Well, I very much agree that we, as the LGBTQ community, need to be looking at the civil rights movement and the lessons learned from that in the 60s. We need to be looking at the reproductive movement that led us to Roe. And yeah, the world has changed and we've lost Roe, but there are lessons to be learned there and applied. And I think that's an important thing to say out loud.
And, you know, I was just, you know, sometimes things come up on your algorithm on your Netflix or whatever. A couple of weeks ago, I found myself watching movies back from the AIDS pandemic. The band played on, and then there's, I forget the other one I watched.
How to Survive a Plague.
So, yeah, and just the lessons there about the advocacy and what the gay community had to do, especially in New York and California, just to get the research and the healthcare that they needed. And that's kind of where we are again now with trans issues. And as far as what happens when they've done with the kids and they come after the adults, you know, they're going to be coming after me too, as, you know, a liberal woman who, you know, supports LGBTQ rights. I joked in my reelect campaign that you know, I am an overweight liberal woman, educated, with a trans kid. I'm like Donald Trump's worst with a disability. I'm Donald Trump's worst nightmare. And so I'll be like probably one of the first cis het people sent to you know, Alligator Alley.
Can we get adjacent rooms? Because it would be great
We
to
can be
talk
roommates,
with you.
yeah. As long as I can bring my knitting. So he's going after the kids. It's only a matter of time before he goes after the adults, before he goes after, you know, well, he's already going after the undocumented, but before he goes after people like me, before he goes after, you know, my nephews who are, have dual citizenship, before they go after my daughter who has mental health issues. I mean, it's just all a matter of time. And we have to stop fighting with each other and stand with each other, in front of each other, around each other, because it's harder to control a mass than it is individuals. We've got to stop letting them pick us off group by group.
Couldn't agree more. One of the other issues in healthcare in general, but it's certainly when it comes to trans care, is the economic gap. I have insurance. I was a teacher, so I didn't get rich, but I was comfortable enough to take early retirement in order to start this transgender advocacy path. Not everybody has that luxury. In fact, a hell of a lot of people don't. So what are we doing? What are we planning for in terms of low-income trans folks in the wake of all of this mishigas?
Well, that's again where this discussion of creating a public healthcare program seems like the direction to go, because we were getting there in terms of Medicaid coverage, but obviously that's come to a rapid halt. And so if we can move in the direction of our own independent public healthcare system, we'd be able to do that. Because, yeah, that is so painful. If I'm not going to say if, that's the barrier for folks.
I mean, here's what I would like to work towards. What I'm working towards is where nobody has to worry about the health care that they need. Gender affirming care is health care. Reproductive health care is health care. Abortion care is health care. mental health care is healthcare. I would love it, and I want to work to that point where we have that for everybody, and that everybody has access to it. I think these regional cost sharing programs are going to be the way to go, and I do think the Republicans shot themselves in the foot because they're pushing us towards universal health care much quicker than they thought they were going to.
If you would like a vivid and tangible story of what being trans and on the low end of the income is, I strongly encourage you to pick up Tourmaline's new biography of Marsha P. Johnson. It's just called Marsha. There was so much in there that I didn't know about Marsha. A very complex character who is, it's rare that you could say this person helped start a movement because of her bravery and was a genuinely, in some ways, disturbed homeless person at other times. And that balance comes out beautifully in this book, and I can't recommend it enough. We are closing in on 8, and I know you folks have other commitments. So last question, if that's okay. Or we could come up with like 17 or 18 other questions. As much as I disagree with what Yale and Children's did, I can at least agree that those are decisions nobody wanted to make. Nobody was saying, "Hey, let's do this ahead of the." I get that. Nevertheless, I'm wondering if there should be consequences down the road. So the question as it's written is, how will the state manage accountability for programs and hospital systems that are complying in advance? Is there a strategy to push back against program closures being explored? I'm adding to that somewhere down the road, probably after my lifetime, when this pendulum swings back. Are we looking at those institutions as Neville Chamberlain?
I don't know right now if like those are, from my end, I don't know if they're being explored like that. I just keep thinking about how if, you know, more and more providers are closing or they're not providing these services, just thinking about how our already strained like nonprofit system and those folks that are trying to work with our communities are, so we got to keep working to just make sure that we are funding those folks properly, which we haven't been doing. And it all really comes back to we have to get more people on to this. I know there are a lot of supporters and there are a lot of people fighting the fight, but we just need to get more legislators, more people on board to make sure and join the fight with us and be allies. And so we can maybe down the line, like you're saying, hold people accountable. But right now, I am not seeing that from my perspective.
I think Yale and CCMC, and I'm going to age myself here, were given a Sophie's choice. And for those of you who don't, go watch the movie. It's a heartbreaker.
I just referenced Neville Chamberlain,
Yeah.
so you could do Sophie's Choice.
I have a long list going.
So as far as holding them accountable, I don't think that's something the state can do because they're trying to follow state and federal guidelines and and so as individuals, obviously 100% you can use the power of your pocketbook and not go to Children's or go to Yale. You can choose a different provider. And I think, you know, that's an incredibly valid thing to do. And it can be a very powerful thing if the entire LGBT community says we are not going to be going to Yale facilities. That's, you know, can be very powerful. I'm hopeful we'll get to some place where we have an independent provider that's free of Medicaid, free of our federal regulations. And if I could just, because I know we're closing up here, one thing I do want to say is that there's some amazing pride centers all around the state who are helping individuals with not only community and advocacy, but also financially. I'm going to put in the plug for the Bridgeport Pride, which is the next town over, which is run by one of our colleagues. They've got an amazing store in the back of the room. You can go in and shop for clothes, you know, because if you need different clothes. So support these pride centers any way you can, and just keep building your communities. The stronger the community is, the harder it is to break.
I had not thought about like down the line, any kind of penalty. I think again, because it was just this horrendous choice forced upon them. That said, to me, it's about the leadership at the top. And when it comes to the Attorney General, he's amazing and he's walking the walk and talking the talk. I want to hold the governor accountable. Again, lessons learned from reproductive rights. The governor stands and makes grand announcements about being a state that welcomes women to have abortion care and welcomes the LGBTQ community. And if he is going to stand up and do that when something like this is happening, he should be the first one out there declaring what the plan is, how we're going to support people, because he invited folks to come to this state to be safe. And I have not heard a peep about this issue. And so that's where I'm very frustrated. And so before we'd ever go after the entities themselves, I'm calling on the governor to step it up. What are we doing? What's the plan here?
Thank you to the three of you so much for this. You were fantastic. Thank you all for being here.
Thank you guys.